Hello, my name is Alison Werner, and I am the Chief Editor of Orthodontic Products. Thank you for joining us for today's episode of In the Sterilization Room with Jackie, where we talk to infection prevention expert Jackie Dorst about what you need to know to keep the orthodontic team and patients safe during the COVID-19 pandemic and beyond. For over 30 years, Jackie has been a consultant specializing in instrument sterilization and infection control and prevention in the dental setting. She has degrees in microbiology and dental hygiene and has been a featured speaker at the American Dental Association and the American Association of Orthodontists. Now, we've been on a little bit of a hiatus, Jackie, but it's good to see you again.
Yes,
Happy New Year.
happy New Year, and we're now in January of
Mhm.
2022
I
and
know.
approaching the 3rd year of the
I
pandemic.
know. I know. I
Yeah,
know. We're coming up on our 2-year anniversary of doing this podcast or this video
exactly.
series. So, yeah. So today, in the ongoing saga that is the COVID-19 pandemic, we're going to talk about the Omicron variation or not variation, no, variant. There you go. There's the word I'm looking for. So we hopefully will provide some clarification to orthodontic practices about how they should navigate this wave. So, Jackie, how has the Omicron variant been affecting practices from what you've heard?
Well, the first cases of the Omicron variant were identified in the United States December the 1st of 2021. And in 4 short weeks, it rapidly spread across the nation. Until by the first week in January, every state had a case. And even there were enough cases that it was putting hospitals into staffing shortages
Mm,
because of the increased number of patients and because so many of the staff members had acquired infections with this highly infectious variant
mhm.
that they didn't have adequate staff to care for the patients that were arriving at hospitals. So Omicron is much more infectious, estimated to be anywhere from 1.5 to 3 times as infectious as the ancestral virus and of the Delta virus with it.
Mm,
And people seem to get sick much more quickly. The virus replicates quickly and with large numbers. It's replicating, the Omicron variant is replicating in the upper respiratory system, around the
mm,
thorax, the back of the throat, in the nose. And because of the large viral numbers, the load, if you will, then as people exhale, whether it's talking, laughing, singing, breathing, that we've heard over the 2 years of the pandemic with it, they expel a lot more viruses than they did with the virus when it was replicating in the lungs. You know,
mm.
originally we learned that the virus, it liked the respiratory system. The viral particles would enter the cells that line the lungs and reproduce there, and then be expelled. So Omicron has, as a variant, has changed
Mhm.
so that it has become more infectious and is infecting more people. And it's also avoiding the protection that vaccines are providing with us.
Mm. Yeah.
So we're
Yeah.
getting more breakthrough infections for people who have been vaccinated, and people who were vaccinated as early in 2021 as the vaccines were introduced. Then that vaccine, the protection was waning, which happens
Mhm.
with many vaccines, as after you get that high boost of antibodies right after you're vaccinated, and then it levels out over time. And so then we've started using boosters, right? 6 months after you've
Mhm.
had your mRNA vaccine, then it's now recommended that you have a booster to up those antibodies again and give you that greater protection with it. And Omicron is, as I said, it's highly infectious and it's found ways to get around the protection provided by the boosters and even people who have acquired immunity from having
Right.
had a previous infection with it. And you know, one of the largest segments of our population now that doesn't have that protection is children.
Mhm.
And as
Yeah.
children have started going back to school, we've seen an increased transmission of infections. So Omicron is affecting not only the orthodontic staff, but
Mhm.
orthodontic patients that are
Yeah.
coming in for treatment with it. And it's been challenging because with the quarantine and isolation recommendations from CDC, staff
Mhm.
members, I've had orthodontists calling me saying half of my clinical team is out on
Mm.
quarantine or isolation and they're going to have to be out for 10 days to 14 days. Jackie, what are we supposed to be doing?
Yeah.
And CDC did change their guidance on
Right.
December the 23rd because of the staffing shortages and
Mhm.
looking at the science of the infections and how severe they were at the very beginning of the infection. And did that highly infectious period subside a little more
Mhm.
rapidly with the Omicron variant?
Right. Well, let's talk a little bit about that CDC guidance from December 23rd. Now, the guidance is for all of healthcare professionals because the CDC is no longer separating out dental health providers. So, how should the orthodontic practices interpret this guidance? Because it can be a little confusing.
That's right. It's true, Allison. CDC removed the separate page for interim infection control guidance during the pandemic for dental offices,
Hmm.
and then put an umbrella for all of healthcare. So not only dental, orthodontic, ambulatory surgery centers, and hospitals
Hmm.
now all come under the same guidance for protection for staff members and for patients during the pandemic. So it is confusing
Hmm.
because with the December 23rd guidance, it was shortened that staff members who were exposed didn't have to quarantine or quarantine at home after an exposure incident. That's the correct term. You isolate if you're infected,
Hmm.
and you quarantine if you've been exposed. They didn't
Hmm.
have to quarantine for that 10 to 14 days. Now it was 5 days. But there was a little bit of confusion about how this applied because the guidance came out with a chart that listed 3 categories, and again, this is for all of healthcare workers,
Hmm.
and the first category, the first column of the chart was conventional. So that is conventional strategies when you, don't have an increase of infections and a shortage of staff
Mm.
to care for patients. Now remember,
Okay.
CDC is looking at hospitals.
Right.
So hospitals can have emergency patients that it may not even be COVID related, and they don't have enough
Hmm.
nurses, lab technicians, and physicians to care for all those patients. And we've been
Right.
reading about hospitals that are overwhelmed, and they're having to call in the National Guard to help with it.
Hmm.
And hospitals are even closing certain segments of their hospital. I know in Miami, one of the hospitals had to close their OBGYN unit
Ah,
where they
okay.
couldn't even deliver babies because they didn't have enough nurses and
Mm.
doctors. So
Okay.
that's where they went. Then, if you have a shortage of staff, they added a contingency column
Mm. Okay.
and gave allowances for when could staff continue to work and when could they and when can you work if you had to even tested positive but maybe didn't have signs or symptoms. And
Mhm.
then there is a third column, crisis. So this is very similar to what we looked at with the guidance on PPE. Remember at the beginning of the
Oh, yeah.
pandemic where
Mhm.
if you couldn't get an N95 respirator, then
Yeah.
what was your contingency? And if you
Right.
couldn't get any mask, what was your crisis with that?
Right. Okay.
And now that the PPE supplies have been resumed, we are
Mhm.
now under conventional
Okay.
categories. And that emergency
Okay.
use authorization, even for KN to use KN95s, that's been removed because we're
Mhm.
no longer in those
Right.
contingency or crisis categories. So it's
Right.
it's really a similar to
Okay.
where are you?
Okay. So most orthodontic practices then are gonna be in that conventional, uh, column.
Correct, and, however, I've had a lot of confusion because doctors
Mhm.
have been calling me saying, "Half of my clinical team is out
Yeah.
because they either have a child at home who
Mm.
has tested positive or is
Right.
has symptoms, and so they're
Mhm.
having to quarantine with that child because that's
Yeah.
a high risk exposure incident,
Mhm.
or they've tested positive, they may not even have symptoms. So they said, "Okay, Jackie, with this new CDC guidance, does that mean that my staff members only have to be out for 5 days?" And I said,
Mm.
"Well, wait, we need to look closely at the chart.
Mhm.
And when would you move your practice to the contingency?"
Okay.
So, looking at you have to go to a whole separate web page from CDC about when you would move to those contingency column on it, and that would be only after you've had to cancel non-essential orthodontic appointments because you don't have enough clinical assistants to see those patients.
Okay. Okay.
So
So it's down to staffing.
it is. Do you have enough staff to care for your patients? So, for example, if are you canceling all of your new patient exams? That's non-urgent at this time.
Mhm.
Maybe an archwire check or a retainer check. Those that would not that those appointments could be postponed and not
Mhm.
affect patient care.
Okay.
And then the second category that CDC put in there, or qualifier, if you will, is are you now moving administrative team members to the clinical area? Maybe you have a treatment coordinator who
Mm,
was formerly an orthodontic chairside assistant. And
okay.
is that treatment coordinator now seeing clinical patients because you don't have enough patients or enough
Mm,
team members to treat
okay.
patients?
Okay.
And yes, there are urgent patient appointments that you still need to see, such as
Mhm.
if you have a patient that's got a palatal expander in. That's
Mhm.
not something you would want to put off until
Right.
the infections subside in your area.
Yeah.
Are you in that period of high infectivity? So, have
Mhm.
you made those two adjustments, if you will, so you can continue by providing patient care? And then the third thing I would say is, have you added in an extra day? Maybe you
Mm,
normally work 3 to 4 days a week. Are you
right.
now working 5 days a week in your
Right.
orthodontic office so that you can see those extra patients with it?
Okay.
So, those changes, have you made those adaptations, in your and that would move you into the contingency category? So, yes,
Okay.
most offices would still now be in the conventional column, and I think it's
Okay.
important for us to review what are the
Yeah.
precautions now from CDC.
Right.
It's
Because even though
confusing.
it's confusing, we talked about it earlier and I was confused. So,
Yeah.
yes, please break it down.
So if you'll bring up the chart on the
Yeah.
screen from
Yeah.
and list the web page so that the
Mhm.
viewers could go to it, for
Mm,
those who can see, and for those who can't, if you'll just go to the CDC, you want to look up the December 23rd guidance for it
mhm.
on there. And if we're looking at work restrictions for healthcare providers who are infected,
Mhm.
so that would be someone who tests positive or definitely has signs and symptoms of the
Right.
disease.
Okay.
Then, if they've been boosted, vaccinated, or unvaccinated, so this is someone
Mhm.
who's infected, then they're
Yeah.
still under conventional strategies. They're going to isolate at home for 10 days.
Okay.
That hasn't changed.
Okay.
Or 7 days. It can be shortened if they have a negative test. Then they could
Okay.
return to work after 7 days.
Okay.
If they're asymptomatic or mildly symptomatic
Mhm.
with improving symptoms, then they can return after 7 days.
Okay.
So that's
Okay.
conventional strategy with it
Okay.
for someone who's infected or has
Mhm.
tested positive.
Okay. So testing is key there to
Mhm.
return. Okay.
Yes. Okay.
Okay.
Now, work restrictions for someone who's asymptomatic and has had that high risk exposure,
Mhm.
being exposed to someone for more than 15 minutes without a mask on.
Okay.
So let's take, for example, an orthodontic assistant
Mhm.
whose second grade child
Yeah.
has come home with an
Mhm.
infection, has tested
Mhm.
positive.
Right.
Definitely, that's a high risk exposure. So
Yeah.
we'll see that if you are boosted,
Mhm.
vaccinated, and boosted, because remember, Omicron has learned to get around the vaccination, that boosting gives you the higher antibodies that is helping to prevent those breakthrough infections.
Right. Yeah.
So Omicron is causing breakthrough infections, even for people who are vaccinated or who have acquired immunity. So the
Yeah.
conventional strategy there is no work restrictions for someone who's exposed. So the orthodontic assistant has a child at home who's infected. She can still continue to come to work if she tests negative on day 2.
Okay. This is for someone who's boosted.
This is for someone who is
Right.
vaccinated and
And
boosted,
boosted.
okay?
Right. Okay.
And then she or he would still need to go
Mhm.
for a second test on
Mm.
days 5 through 7.
Okay.
So if the orthodontic assistant's child comes home on Monday,
Mhm.
has from school, has an infection, then on Wednesday,
Mhm.
She can continue to work Monday and Tuesday,
Tuesday,
but if
right.
she's fully boosted
Mhm.
and get a test on Wednesday, if it comes back negative, she can continue to work and then go for
Okay.
another test on Monday, the
Okay.
following Monday. So
Okay.
that makes
Okay.
so that's fully boosted.
Okay.
Now, the second category under the conventional strategy is
Mhm.
if the employee is vaccinated or
But not boosted.
unvaccinated, not boosted,
Yeah.
or unvaccinated,
Yeah.
or has had a prior infection within the 90 days, meaning
Okay.
that's acquired immunity,
Right.
then the conventional strategy is still going to be 10 days of isolation at home,
Mhm.
excuse me, of quarantining at home with within at home, or 7 days with a negative test.
Okay. Okay. So no, they can't come into work.
Yeah, yeah. So
Okay.
I think a lot of the confusion came because this was a general guidance for hospitals,
Mhm.
ambulatory surgery centers, dermatologist
Right.
offices, and orthodontic offices.
Yeah. Yeah.
And, everybody was confused and they didn't know the definition for conventional strategy, contingency, and crisis. Obviously,
Right.
we wouldn't have the crisis category in the orthodontic office, but
Yeah.
you might go into a contingency category
True.
if you had a high rate of infectivity in your
Yeah.
community
Right.
and you had a number of team members that are out.
Mhm.
So
Okay.
I think that will help them to follow this chart and
Okay.
determine the isolation or quarantine time.
Okay. Well, so once they've got that sorted, what should practices be communicating to their patients then? What's your advice?
Oh, that way the patients are just as confused as we are in the
Yeah, I would
orthodontic
definitely say
office.
that. Yeah.
And I think because there's been it's like the information changes daily and
Yeah.
you go, does this apply to me or does it not?
Mhm.
And I'm going to refer to Dr. Chuck Gulland in
Okay.
Pennsylvania, and it's
Mhm.
Gulland Orthodontics. And they came out with the best social media post on their Facebook page, and they had
Mhm.
4 pictures in there, and they
Mhm.
showed disinfecting the chair and the form that they use for checking and asking about symptoms for
Mhm.
patients, and then
Yeah.
taking someone's temperature, and then with their surgical mask and their face shield on, and you
Mhm.
could still see the eyes smiling behind
Yeah.
all the PPE.
Yeah.
And what the message said was, "It seems like so long since we first heard the word COVID. We know everyone is weary of the rules, the regulations, the precautions, and the procedures. We are too. But the health and safety of our patients, family, doctor, and staff are too important for us to let down our guard. We still perform a check in for all appointments, check temperatures on our staff as well, disinfect common areas, the equipment, the doorknobs, and the counters. We require masks for everyone in the office, and of course, we wear our PPE.
Mm.
Is every business doing this? Maybe not, but we do. We appreciate your cooperation and understanding because hashtag we're in this together."
Oh, that's nice.
What a
Yeah.
positive message to your
Yeah.
patients and giving your staff that high five, that pat on
Mhm.
the back.
Yeah.
We've gotten through this pandemic
Mhm.
successfully, and
Yeah.
we are going to continue to get to the end of the pandemic when the
Yeah.
SARS-CoV-2 virus becomes endemic and not
Mm.
a pandemic.
Right, exactly. Well, Jackie, just real quick, can you just run down the precautions, everything that the practices should have in place from masks down?
We really need to adhere to those 7 basic infection control standard
Right.
precautions, if you will.
Yeah.
But I think it's really important at this time, just like Dr. Gullen's Facebook page said,
Mhm.
is for us to remember not to have separate patients in the reception room and
Yeah.
not to overload them in the reception room.
Yeah.
Continue to check on those symptoms and
Mhm.
continue to do the pre-procedural mouth rinses
Right.
to reduce the viral load. Make
Mhm.
sure that you have that MERV 13 filter
Yeah.
installed in your heating and air conditioning system,
Mhm.
and make certain that your vacuum is working the most efficiently, that when you use it, it can reduce those aerosols
Okay.
that are created should we use a high speed handpiece. And whenever you're doing aerosol generating procedures, continue to wear an N95 respirator.
Yeah.
Those are key elements to keeping us safe and keeping our patients safe.
Exactly. Well, thank you so much, Jackie, for really unraveling this for all our viewers. And it's great to see you again. It's nice to be back for our viewers. And please check back soon for the next episode of In the Sterilization Room with Jackie. In the meantime, to catch up with past episodes or to check out the latest orthodontic industry news, visit our website at orthodonticproductsonline.com. Until next time, take care and stay safe. Thanks, Jackie.
Thanks, Allison.